think communication is so vital in medicine. So the NHS has to have an effective communication strategy to allow patients to understand their treatment options, the plans for the health system, and also to access some of these services across the UK, as well as for the providers who will be treating patients on a daily basis to understand the requirements and how they communicate better some of their policies and ideas around treatment strategies. So the way healthcare is changing with new ideas about therapies, treatment, prevention, for example, in clinical practice, will mean a different way of working for not only doctors and healthcare workers, also for patients to access that healthcare system. As we move to a more personalized healthcare system, with patients being responsible for their own health and being more autonomous and having freedom of choice and being independent for strategies, I think it's absolutely vital that this information is passed effortlessly through the system. So if you look at secondary care, primary care, and the end user, the patients, so social care, this breadth of the NHS needs to be more integrated so the information passes freely and actually it's as accessible as possible. When we look at the patient journey, it's always been difficult sometimes when there's friction through a system. There might be miscommunication, and there also might be struggle in terms of language barriers, etc. So it's essential that when we bring out new ideas, those are conveyed in a way that the patient understands them. And I think it's essential that that communication is done properly to ensure compliance and to bring the patient on that journey with the system. Otherwise, you get non-compliance and bad outcomes. Ultimately, better communication improves the patient's journey experience and improves the outcomes. So one of the great things about the NHS, it's its role in innovation and implementing new ideas, that could be technology, into the healthcare system to allow patients to have better experiences and outcomes. From my own experience, as being an innovator and a futurist, for example, when I did the world's first Google Glass operation, streaming live operation across the world, or indeed doing the first operation in virtual reality, is to ensure that we were scaling the ideas to a large population. For me, it was about how do you educate a lot of people rather than one or two people that might be close to you. How do you scale and teach hundreds and thousands of people around the world to allow us to improve global health, improve access? And so I felt that technology will allow us the way to improve access across the world. I think innovation lies at the heart of medicine. Over the last many centuries, there's always been innovations in healthcare to drive change, whether it's cancer care, diabetic care, cardiovascular care. We've always brought new interventions in, to wet stents in cardiovascular surgery, for example, which replaced open heart surgery, or now using virtual reality for training the future generation of nurses and doctors. It's absolutely necessary. The NHS maintains its foothold in innovation and becomes a leader around the world in showing how we can implement these changes and new ideas into clinical practice rapidly. And the COVID pandemic has actually forced us to think differently, has asked us to innovate much more quickly. And what I'm pleased about is that the healthcare system and the NHS is ready for change, finally. And that's going to be good for the patient. So the NHS has now embraced what's called extended reality. That includes augmented reality, virtual reality, mixed reality over the last few years, and actually has now put aside funding to allow new training methods to be developed using virtual reality and augmented reality. And now we are training nurses, doctors, surgeons, medical students across the UK using these latest technologies. And I think that adds a value from traditional models of learning, like books and e-learning platforms. And we're just moving seamlessly onto the next generation of tools that allow us to learn better, faster, quicker, and retain more facts. It should not be replacing traditional methods. It should be supporting, augmenting what we use already to improve people's experiences with education. So So virtual reality has now found its place in medical education and also medical therapy. We're now using virtual reality to treat patients. For example, in the US, they treat patients with chronic back pain with VR therapy, showing an outcome that's improved. In terms of education, we're now seeing medical schools, nursing schools, postgraduate training programs, allowing people to now engage with avatars that look like patients, for example, using other technologies to allow them to improve their communication, to improve diagnosis, and improve the clinical outcomes. So now we're seeing a huge change in the way that the future generation of students are being taught, and also for people who are health workers who are now looking for postgraduate training or continued professional development using these tools for further learning. The metaverse is clearly in its early phase. We call it the 3D of the internet. It's a number of technologies coming together to create a kind of immersive experience for people going forward. What I see the metaverse as being an additional way of interacting with patients in a virtual environment, also for education purposes. So it might be that patients can learn about drug therapies or which drug to take and the complications and see graphic representation in 3D virtual environment. We see also a way of collaborating. For example, doctors around the world could collaborate for a multidisciplinary team meeting, talk about patient care using teams from around the world. We also see it, for example, in education. For example, anatomy teaching in the future could be based around different specialists coming together, students around the world, connected with 3D objects and animations, allowing people to train people virtually. So I think the metaverse is certainly an interesting concept. I think it will find its place over the next few years as people look for other ways of accessing their healthcare system, their doctors and nurses, also different ways of learning and have experiences that will improve their experiences through a healthcare system, and hopefully it'll also improve outcomes. So I do see the metaverse being rolled out at some stage in the next few years, maybe as pilots initially, and maybe then a wider rollout for ways of value. It adds additional value to healthcare at the moment. We have conventional face-to-face, which is amazing, and it's still the right way of seeing our patients. And as a cancer surgeon, of course, there's that physical contact, the closeness that's very important when breaking bad news, for example. We've now moved to telephone calls and Zoom calls and remote kind of ways of seeing patients, which adds value and puts patients at the center of that they control their healthcare because it's at their convenience, at their time, at home. That's been a game changer for all of us. The last bit is, where do you go with that? The metaverse adds the additional way of being virtual and seeing people in a different environment. So it's going to be a natural fit at some stage, offering patients the choice of how they're seeing, where they're seeing, and how they get their education and treatment. The current buzzword in medicine and technology is artificial intelligence and large language models, things like ChatGPT and Bard and Google. You can't open any social media platform without seeing evidence of this. So I think it's very important in communication. First of all, AI will be the powerhouse of the health system. The chatbots, the triage systems work in the background to allow us to see many more patients much quicker, also be used in diagnostics like radiology, X-rays, CTs, etc., being helpful with diagnosis at a rapid pace. So definitely AI will be helping supporting healthcare in the future. Also, if you look at the current technologies like the LLMs, we're now seeing people converse, communicate using chatbots, give information. You can now ask ChatGPT for example, around your diagnosis and the offers of what kind of treatment should you have. You can have interactive discussion with a ChatGPT. That's great for patients. It'll empower them more with the evidence, with the information they might have. It might also help in literature, research articles being written through some of these LLMs, help us to define our communication strategies of how to communicate with a patient with X, for example. It'll tell you about what the kind of framework might be. It'll make our life much easier as healthcare workers. It'll help communication. And I think it'll make things a lot better going forward, much faster, much more rapid. And I think the access to knowledge and information is going to be key. The future of healthcare is data-driven. It's going to be personalized. And the question, of course, will AI technology make us more human? I think it will give us much more time to be human and spend time with the patients as we're trained to be. I think as we go forward for the next 2 or 3 decades, communication is becoming increasingly vital to be accurate, to be transparent in the face of kind of the world we live in, where there are kind of the people would argue there may be lack of transparency sometimes with social media, etc. Let's just say again. Let me go back. Okay. So the next 2 or 3 decades, communication will also have to evolve and change. We have now many different ways of communicating with either clinical staff or the patients. We have, of course, online platforms. We have the news. We have the social media platforms, which are now proliferating. We have the social media channels. We have images, databases. So if you think about where we are now, people want information immediately that's accurate, that they can actually respond to. They want it at their fingertips in a few seconds, 1 or 2 clicks only on the internet. Communication has to reflect who we are as people now, wanting things immediately, fast, reliable, that we can trust. And that's going to be the key going forward. How do you trust information now that we see through various platforms? And as long as we have suitable platforms that we have trust with, that have the background that we kind of can use, as a patient, for example, I'd want to make sure I can access that information in the correct manner, that's validated, and also I can rely on to make my own decisions. So there's a huge challenge out there to get it right. And I think the communication strategy has to be, it's almost like a science in its own now, evolving science. And how do you communicate effectively, given the current constraints of the world that we live in, to ensure that it's accurate, reflective, and transparent. And that's all that you can do.